Hi everyone, my name is Sarah and I am one of the live study group facilitators here at Sarah Michelle NP Reviews. While I've been working with Sarah and our fantastic nurse practitioner team for about the last year and a half, I've also been working full-time as a family nurse practitioner in orthopedics. So many students and new nurse practitioners ask me daily about working in a specialty office as a family nurse practitioner. So I would like to share with you just a little bit about how I found myself in this position, what my typical day looks like, and then why having that more diverse educational background is actually still so beneficial for a specialty office, and then just a few tips and tricks I have for you new NPs just starting out. I think the very most common question that I get asked about working in orthopedics is how on earth I was able to get this job right out of school as a brand new nurse practitioner. My biggest piece of advice, especially to those still in school and those still working as nurses at the bedside, is to take the opportunity to try out other floors and other units as much as you can. I previously worked on a neuro floor at our local hospital during my bedside nursing days, and while that was great, I had no idea what else was out there and what else I might fall in love with even more. While at the bedside, even though it was scary, I was always one of the first to volunteer to be pulled to other shifts and other units during my shift so that I could try out other things without really having to get a new job. During NP school then, I also took advantage of job shadowing. During clinical, as many of us know, we're not usually able to try out certain specialties or very many specialties at all, so I really did my best to shadow other NPs during my free time, again, to just expose myself to as much as possible before landing that first job. And it was actually being pulled to the orthopedic unit in the hospital during my very first year as a nurse that ultimately landed me this nurse practitioner job right out of school 4 years later. I had always been confident that I wanted to work in pediatric oncology after I finished NP school, but actually working on the orthopedic unit that night as a nurse made me realize that I absolutely loved taking care of this patient population. During that shift, since I was loving it and enjoying myself, I started talking with the nurse manager, other staff on that floor, and I ended up getting a lead actually on a nurse position in one of the outpatient orthopedic offices associated with our health system. So I went and applied the very next day. I landed that interview and I made the switch at that point. So I then proceeded to work in this office during NP school, and I did some heavy networking with all of my coworkers, the practice managers, and the providers in my office to get that in and make them very aware that I was interested in transitioning to a nurse practitioner role upon graduation and continuing with that office. So I guess my bigger point of telling you all of this is that networking is key, and you just absolutely never know where an opportunity might arise. So I really encourage all of you to go outside of your comfort zone, try to job shadow, try out new positions now while you're in school, talk to that stranger while you're waiting in the grocery store line. You really just never know who might have a friend of a friend that has an in somewhere that you want to be. So I think the best place to start a deep dive into my orthopedic world is by discussing what type of patients I care for, because this might surprise some people. So my office as a whole sees all types of orthopedic complaints, but I personally specialize even further than just orthopedics, and I see specifically all things foot and ankle. So I see chronic problems like your bunions, your flat feet, your hammer toe deformities, arthritis, even just your generalized foot and ankle pain. But I also see some more acute concerns like fractures and gout and some plantar fasciitis flare-ups, even neuromas and ganglion cysts, and the list truly just goes on for what I see. And then I do also frequently see some post-operative patients who had surgery, both for chronic deformities, post-ops for amputations or fractures. And then in my orthopedic office, in the foot and ankle section specifically, we have 2 orthopedic surgeons, but then we also have 3 fantastic podiatrists that I work really closely with. So I have the pleasure of seeing some of their patients who need diabetic foot checks, nail fungus, new diabetic foot wounds. So I see all types of things. And then in addition to your typical office visits, I do a variety of procedures as well on a day-to-day basis, such as ingrown nail removals, joint injections, some cyst aspirations, even just closed reductions for some more minor things like toe fractures. One thing that I loved about the specialty office was being able to do these more in-depth and specialized procedures that I may not have otherwise done in a primary care setting on a regular basis. So the next important thing I feel like to go over with you guys is to discuss who I work with. So who I work alongside does change day to day, actually, depending on where I am that day. So in my typical outpatient clinic day, I work alongside orthopedic surgeons, the podiatrists that I mentioned previously. I work with athletic trainers, medical assistants, and then our clerical and referral staff. And then while in the hospital, I work more closely with the admitting providers of the patient and the nursing staff. And then during surgery, I of course work closely with the doctor that I'm with, but also the anesthesiologist and then the surgical staff. And then in addition to all of those things, I work pretty closely with our local wound clinic and our vascular surgery team as well, both inpatient and outpatient, because we have a ton of mutual patients. Especially for our diabetic friends, care coordination is absolutely crucial for positive outcomes for these patients. So it's absolutely a job where I'm involved with a ton of different people and a ton of different job titles. That's what keeps my job very, very interesting. So what does a typical day look like for me? Knowing the patient populations that I see and who I work with, I think let's go into a little bit deeper on my typical day. It can vary quite drastically as well. So being in a specialty office, I will rotate between covering our outpatient clinic, I rotate in surgery, and then I do some inpatient hospital rounding as well, both for our established patients that are admitted, but also for new patients who present to the emergency room. So on average, I work from about 7:30 a.m. until about 4 p.m. daily, give or take that start and end time depending on what that day entails. And then I'm also on call for 1 week at a time on a varying schedule, just depending on the need for our office. A typical day in the outpatient clinic consists of about 20-minute appointments, and I see roughly 21 patients a day. Clinic runs from about 7:40 to 3:20 and allows me a little extra time at the end of the day for some admin time to catch up on charting, catch up on patient messages that come in throughout the day. A surgical day changes, of course, every time depending on who is scheduled for surgery. We frequently have some trauma patients that we need to add on, so it's typically a mix of correcting some more chronic issues and then fixing the traumas as well, which is another thing I love about this position. You just never know what to expect on a surgery day. And then lastly, a day in the hospital consists of seeing anywhere from about 1 to 15 or so patients, depending on who's admitted at that time. I will see the new consults, I see postoperative patients, I follow non-operative patients that are there for problems such as infections. And then speaking of care coordination, again, the inpatient world is where this care coordination is huge. I am always in communication with the primary admitting team, with the vascular team, the wound care team, and then even in contact with other specialties that are caring for the patients to ensure that we're all on the same page, we're providing the best quality care, and we're also doing so in the most timely manner for these patients. Now, a very common concern that I hear from students and new NPs alike that people ask me daily is, am I worried about being in a specialty office and forgetting all of my primary care knowledge? And while that absolutely was a concern that went through my mind, I can now confidently say that I am not concerned about this. So aside from working for the lovely Sarah Michelle and being able to keep up on my knowledge through teaching, I strive actually to keep up to date on the most primary care things simply because it's something that directly impacts my patients that I frequently care for and alters the care that I provide them. So a few examples of this being a patient who presented to me with intermittent ankle pain, but quite significant ankle swelling. And aside from the swelling, his exam and the x-rays were benign. So we discussed his history a little bit more and come to find out he had recently started a new blood pressure medication, and sure enough, this was probably the cause and contributing factor to that increased ankle swelling he was having. Absolutely not an orthopedic complaint or anything that I could treat, but knowledge that allowed me to prompt him to reach out to primary care to discuss different alternatives and look into this a little bit further. And then another example that I rather frequently see are people that have peripheral arterial disease and chronic venous insufficiency problems. So especially with your peripheral arterial disease, people are going to present with just some generalized aching pain in their feet. As we get more into the conversation at the visit, come to find out it's probably that peripheral arterial disease causing a lot of their pain. So again, it's not an orthopedic complaint or anything that I can necessarily treat, but absolutely something that had I not been aware of, had I not been a family nurse practitioner, I wouldn't necessarily have thought that the peripheral arterial disease was a problem for them, that it was causing their foot pain, and it may have changed my treatment plan a little bit. So what do I love about my job? I think that the best way to start wrapping things up here is to tell you what I love about my job, and then also one thing that is important to ask and look into when interviewing for a new job. So believe it or not, this is a bit of a tough question for me to answer because there are truly so many things that I love about my job. But I think the biggest thing that I love is my team and my coworkers, which I personally feel can truly make or break a job for students. So from day one, they have been so welcoming, they've been so understanding of the fact that I'm not only a new nurse practitioner in their office, but just a new nurse practitioner in general. So for those of you just starting out, especially in a specialty office, I want you to ask all of the things. It never hurts to ask a question. Just as you are not expected to know everything for your board exam, you are absolutely not expected to know everything in your first job, or ever for that matter. So being okay with not knowing everything has been a scary adjustment, but it has really allowed me to learn so much more than I could have imagined, and so much more than if I had the mindset that I know everything and that I don't need to ask questions. And it kind of leads me right into what I think you should ask when you're interviewing. So ask the interviewer, how does your team work together on a daily basis, and what is the expectation for conflict resolution for your team? This is going to help give you some insight into the team flow and maybe even some personality types to determine if you would mesh with that group. And while everyone doesn't have to be best friends, knowing that the office has a solid conflict resolution strategy in place is going to be huge, so that when problems between coworkers arise, it's dealt with appropriately, it's dealt with professionally, and it's not something that's going to impact the office and impact you as a whole. So if you haven't gathered it already, I do love working in a specialty office, and I would absolutely encourage any and all of you to go for it if it sounds like something that you would enjoy. And if you've forgotten everything else that I have said, remember this. Find a job that you love going into every single day, and you'll never work a day in your life.